Hi, and welcome to the Peotone Animal Hospital. My name is Abby, and I'm a certified veterinary technician, fortunate enough to be with the hospital since 2002. In this video today, we're going to go over what happens when your pet stays with us for a surgical or anesthetic procedure, and also guide you through the options and services available to you and your pet. For this video, we're going to follow Quinn on her journey for her spay surgery. Here, Quinn is getting her blood drawn for pre-surgical blood work. Blood work will evaluate internal organ function, giving us an overall look at her health. If there's any problems, we can tailor the anesthetic to meet her specific needs or postpone the surgery for a later date. Once the blood work is complete, we will give your pet an injection of a calming medication and also begin their pain control. About 15 to 20 minutes later, after the calming medication starts to work, we place an IV catheter. The IV catheter allows us to administer fluids during the surgery to ensure hydration, proper blood pressure, and immediate access to a vein in case of an emergency. Once the IV catheter is established, we then administer an IV anesthetic to bring your pet into a deeper plane of anesthesia. An endotracheal tube is then placed into your pet's airway. This allows us to administer oxygen and inhalant anesthetic to control the depth of your pet's anesthesia. Once the endotracheal tube is in position, your pet will be moved into a comfortable position for the surgery, depending on the procedure being done, and your certified veterinary technician will begin to monitor your pet. We monitor everything from oxygen concentration, heart rate and EKG, respirations, blood pressure, and body temperature from the beginning of the surgery until your pet is fully recovered. The surgical site is then clipped and the skin is sanitized with a surgical prep solution. Our surgeons wear sterile gloves and gowns for each procedure, and each pet has their own sterile pack of instruments. Here you'll see Dr. Jules using our carbon dioxide surgical laser, which is a highly focused laser beam that can vaporize the living tissue while at the same time seal blood vessels, lymphatics, and nerve endings. The benefits include less bleeding, less swelling, reduced risk of infection, and an overall quicker recovery for your pet. Once the surgery is complete, the endotracheal tube is removed and your pet is moved into recovery, where we will continue to monitor them until they are fully awake. All of our surgeries are sent home with post-surgical pain medication to make sure that they're very comfortable at home.